Well, I touched upon community empowerment because the UN Secretary General, as part of the global strategy for every woman, every child, has said that they have three components: survive, thrive, and transform. And in transform, they want to focus on community empowerment. So I talked a little bit about what that means and some of the evidence around community participation, working through groups which have kind of structured meetings, participatory learning and action. We talked a bit about ownership of health programs so that communities are involved in committees, sanitation committees, health service committees and the like. We talked a bit about workers, and a lot of that in this conference is about community health workers, community health volunteers, etc. We also talked a little bit, because we're in the Sustainable Development Goal era, about links with the environment. And if you're going to have healthy women and children, you need clean energy, clean air, agriculture, good livestock, because we know that emerging infections are often about linkages between human health and animal health. Finally, we talked a bit about resources. The reality is that a lot of people don't get the entitlements they need, and so we need to be monitoring what goes on. Our community is empowered to get whatever they want. The other thing we said was, how do we bring this all together? How can we get the people working on health workers and the NGOs and the governments and the local government and the communities themselves to kind of come up with something that's a coherent plan and looks at the one hand at the community health worker side of the equation, delivering services where they're needed and which is going to be most effective, but also the mobilization side. And how do we link up with nutrition? And this is quite complicated, but I think if we can get some kind of system at district level where a district themselves can look at what's going on around all of these factors and come up not with a score, but some kind of profile of community empowerment, I think that would be extremely valuable.